My name is Darae Ko. I am a cardiologist and a researcher at Hebrew Senior Life. I mainly focus on patients with atrial fibrillation. So atrial fibrillation is one of the most common arrhythmias that we develop as we age. It's a heart rhythm where your heart beats irregularly, and as a result, it puts us at risk of having a stroke. And to prevent the stroke, we have to be on blood thinners. The challenge is that these blood thinners are great. They work very well for people who are younger, who don't have many other things going on. But if you're older and you have multiple other comorbidities, you are at higher risk of bleeding from being on this medication. So striking that sort of balance is what my research is about. We published a paper on the way that we prescribe anti-platelet drugs in patients who have a heart attack and then who need a stent afterwards. Always striking the balance between giving blood thinners, or the anti-platelets that we call them anti-platelets. They're a little bit different from blood thinners, but they increase the risk of bleeding. At the same time, they're very good at preventing another blood clot in that stent. And what we found is that, yes, the older people who are frail are less likely to receive the antiplatelets that we know are better than what we used before, probably because of the risk of bleeding. That balance is much better achieved, easier to achieve in people who are younger, who don't have many other medical conditions. But when you're talking about 75-year-old, 80-year-old, 85-year-old, 90-year-old with multiple comorbidities, it gets much more tricky.
Dr. Darae Ko is one of 26 faculty and 76 staff researchers at the Marcus Institute, uncovering the secrets of healthy aging. Researching medication interactions represents only part of the research we conduct. Within our $98 million research portfolio, we also study the most pressing challenges of aging, including Alzheimer's disease, dementia, osteoporosis, falls, frailty, as well as lifestyle, fitness, and diet changes to improve quality of life. Marcus Institute researchers publish an average of 185 papers annually in top peer-reviewed journals.